Welcome to Medical Solve, and today we are going to be talking about anal cancer. And please don't forget to subscribe and share. And I am your ever exciting host, Emegibo Miracle. Anal cancer is a rare type of cancer that affects the very end and the large bowel. Symptoms of anal cancer. The symptoms of anal cancer are often similar to the more common or less serious condition affecting the anus, such as piles and anus tissue. Symptoms of anal cancer can include bleeding from the bottom, itching and pain from the anus, small lumps around the anus, a discharge of mucus from the anus, loss of bowel control. However, some people with anal cancer don't have any symptoms. Speak to your GP if you develop any of these above symptoms. How is anal cancer treated? If you are diagnosed with anal cancer, you'll be cared for by a multidisciplinary team. This is a team of different therapies or different specialists who work together to provide the best treatment and care. The main treatment used for anal cancer is chemoderation, a combination of chemotherapies and radiotherapies. 2. Surgery, to remove the serum or the large bowel in your anus, or in other cases where the anal cancer has spread and can't be cured. Chemotherapies alone may be considered to help relieve symptoms. Chemoderation is a treatment that combines chemotherapies and radiotherapies. It is currently the most effective treatment of an anal cancer. You don't usually need to stay in the hospital where you are using chemotherapies. Chemotherapy for anal cancer is usually given in 2 cycles, each lasting for 4 to 5 days, with the 4 gap or 4 weeks between the cycles. In many cases, part of the chemotherapies is delivered through a small tube, which can stay in place until your treatment is finished or until the treatment has finished. The tube means you don't have to stay in the hospital during the time of the cycles of the chemotherapy. However, you will be attached to small plastic tube which you can take home with you. A few hospitals now offers tablets for therapy for anal cancer, which avoid the need of pump and PICC. Radiotherapy is usually given in short season, once a day from Monday to Friday, with the break at weekend. This is usually carried out for 5 to 6 weeks. Both chemotherapy and radiotherapy often cause significant side effects, including tiredness, sore skin from the anus, sore skin around the penis, hair loss. These side effects are usually temporary, but there is also risk of long-term problems. If you are concerned about the positive or potential side effects of treatment, you should discuss this with your care team. Other long-term side effects can include bowel control problem, vaginal pains, dry itches, blood from the anus. Tell your doctor if you develop any of these symptoms so that they can be investigated and treated. Surgery is a less common interest, often for anal cancer. It is usually only considered if the tumor is small and can be easily removed. Like if it's easily removed, that's when they will advise a surgery for you. If the tumor is very small and clearly defined, it may be cut out during the procedure called a local excision. If chemoderation has been unsuccessful or the cancer has returned after treatment, a more complex operation should be required. As with this local excision, this operation is carried out under general means. During this operation, a permanent colostomy will also be formed to allow you to pass. This is where a section of the large intestine is diverted from an opening made in the abdomen called a stoma. The stoma is attached to the special pouch that will collect your stool after the operation. Before and after this operation, you will see a specialist nurse who can offer support and advice to help you adapt to life with a colostomy. Adjusting to life with a colostomy can be challenging, but most people become accustomed to it every time. After your course of treatment ends, you will need to regularly follow appointments to monitor your recovery and check up for the signs of the cancer returning. To start with, these appointments will be every weekend or monthly, gradually become less frequent over time. What causes anal cancer? The exact causes of anal cancer is unknown, although a number of factors can increase a risk of having these diseases. These include infections with the human papilloma virus, HPV, a common and usually harmful group of viruses spread through the sexual contact. Having an access or lot of sexual partner, having a history of cervical, vaginal or vulvar cancer, smoking, having weakened immune system, for example, if you have HIV. Your risk of developing anal cancer increases as you get older, with half of every causes diagnosis in people aged is 65. The condition is also slightly more common in women than men. That's all for anal cancer. Till we meet again, please subscribe and share. And if you have any comments, just drop it on our comment section. See you in our next episode. Bye.